Want to score over 850 in your HESI fundamentals exam? Then let's get started. Today we'll be covering 10 questions on basic nursing care. Question 1. A nurse is caring for a bedridden patient. Which action is most important for preventing pressure ulcers? Applying moisturizing lotion to the skin, repositioning the patient every 2 hours, placing a sheepskin under the patient, massaging bony prominences. Pause the video and select your answer. If you chose option B, you are correct. Repositioning the patient every 2 hours. Repositioning the patient regularly helps to relieve pressure on bony prominences, reducing the risk of pressure ulcers. Question 2. Which nursing intervention is appropriate for promoting urinary elimination in a patient with limited mobility, encouraging the patient to drink less fluids, providing a bedside commode, restricting the patient's bathroom privileges, using a indwelling urinary catheter? Pause the video and select your answer. If you chose option B, you are correct. Providing a bedside commode. Providing a bedside commode enables the patient to urinate without having to walk to the bathroom, promoting urinary elimination and maintaining dignity. Question 3. During a bed bath, the nurse notices redness on the patient's coccyx. What action should the nurse take? Document the finding and continue the bath. Apply a protective barrier cream. Avoid cleansing the area to prevent further irritation. Notify the healthcare provider. Pause the video and select your answer. If you chose option B, you are correct. Apply a protective barrier cream. Applying a protective barrier cream helps to prevent further skin breakdown in areas of redness or pressure. Question 4. A nurse is assisting a patient with oral hygiene. Which action is most appropriate for preventing aspiration? Using a hard bristle toothbrush, placing the patient in a supine position, providing frequent mouth care, suctioning the patient's oral cavity. Pause the video and select your answer. If you chose option C, you are correct. Providing frequent mouth care. Providing frequent mouth care helps to maintain oral hygiene and reduces the risk of bacterial growth and aspiration pneumonia. Question 5. Which action is essential when assisting a patient with feeding? Encouraging the patient to eat quickly, feeding the patient while lying flat, allowing the patient to self-feed if possible, ignoring signs of distress during feeding. Pause the video and select your answer. If you chose option C, you are correct, allowing the patient to self-feed if possible. Allowing the patient to self-feed promotes independence and dignity if the patient is capable. Question 6. Which nursing intervention is appropriate when providing perineal care for a female patient? Wiping from back to front, using hot water for cleansing, patting the area dry, avoiding the use of gloves. Pause the video and select your answer. If you chose option C, you are correct. Patting the area dry. Patting the perineal area dry helps to prevent irritation and moisture associated skin damage. Question 7. A nurse is measuring a patient's temperature orally. Which action is correct? Placing the thermometer under the tongue for 10 seconds, placing the thermometer in the axilla for 5 minutes, placing the thermometer in the rectum for 2 minutes, placing the thermometer in the ear canal for 20 seconds. Pause the video and select your answer. If you chose option A, you are correct, placing the thermometer under the tongue for 10 seconds. Oral temperature measurement is typically done by placing the thermometer under the tongue for the specified time. Question 8. Which nursing action is important when providing a back rub to a patient? Using firm pressure, avoiding lotion or oil, rubbing in the direction of hair growth, skipping areas with bony prominences. Pause the video and select your answer. If you chose option A, you are correct, using firm pressure. Using firm but gentle pressure during a back rub helps to promote relaxation and relieve muscle tension. Question 9. A nurse is assisting a patient with ambulation. Which action is appropriate for ensuring safety during ambulation? Holding the patient's arm tightly, encouraging the patient to look down while walking, walking slightly behind the patient, using a gait belt around the patient's waist. Pause the video and select your answer. If you chose option D, you are correct. Using a gait belt around the patient's waist. Using a gait belt provides support and stability for both the patient and the nurse during ambulation, reducing the risk of falls. Question 10. A nurse is assisting a patient with repositioning in bed. Which action is appropriate to prevent shear forces on the skin? Dragging the patient across the bed sheets, using a lift sheet to move the patient, repositioning the patient every 4 hours, elevating the head of the bed to 90 degrees. Pause the video and select your answer. If you chose option B, you are correct. Using a lift sheet to move the patient. Using a lift sheet reduces friction and shearing forces on the skin during repositioning, minimizing the risk of skin breakdown. Join us next Friday and click that subscribe button.